Impact segment tonight. 43-year-old Edith Rodriguez died last month in the emergency room of the Martin Luther King Harbor Hospital in Los Angeles. Apparently, Ms. Rodriguez lay bleeding on the floor of the ER and no one helped her. No one. The situation was so intense that her husband called 911.
Hey, the emergency room, my wife is dying. The nurses don't want to help her out.
Okay, what do you mean she's dying?
She's vomiting blood.
Well, after that, another patient in the ER also made the 911 call.
What's your emergency?
It's a lady on the ground, and here in the emergency room at Martin Luther King, and they are overlooking her, claiming that she's been discharged and she's definitely sick, and everybody's ignoring her.
What would you want me to do for you, ma'am?
Send an ambulance out here to take her somewhere where she can get medical help.
Okay, you're at the hospital, ma'am. You have to contact them.
They have a problem. They won't help her.
Well, they're the medical professionals. Okay, you're already at a hospital.
Okay, and the woman died. Now, joining us from L.A., Joe Hicks, the Vice President of Community Advocates, a nonprofit think tank. As with all stories like this, there is a whole subtext to it. The woman, according to our investigation, was a methamphetamine addict, had been to this ER 3 days in a row looking for painkillers. The hospital didn't take her seriously. However, once she started bleeding all over the place, then you're into a different realm. How do you see it?
Well, you get a lot of patients of her kind in hospitals like that, but there's no excuse for letting somebody die on the floor while janitors are mopping around her. The real problem here, Bill, is a long history. There's no other hospital I know of in this nation that has a nickname, Killer anything. This hospital is known as Killer King by people who live in the neighborhoods around that. It's outrageous, the kind of activities going on there for years and years. It's been enabled, and a lot of political correctness has gone on because the hospital was built after the '65 riots, and it was perceived to be, well, hospital, serving black and poor inner city folks, so therefore just let it alone.
Okay.
So some benign racism, I would argue, going on here.
I don't know if it's benign racism, I think it's just chaos. This hospital is 14,000 people a month, 1,500 in the ER every week. Many of them are drug addicted, a lot of HIV, a lot of violence. But I agree with you. Then you got to be an American, even though she's a meth head, bleeding on the floor, and you got nurses and doctors ignoring her. You can't have it. Is it apathy on the part of people who work there, that they're just so overwhelmed by the horrors of what they see every day? Is that what's going on?
Listen, Bill, there's nothing unique in this hospital. It's not going on in the ER all across the country.
This is worse.
Oh, that's the point I'm making, that their conditions that they deal with are the same that every major hospital in America deals with. Meth freaks, all kinds of folks coming in needing help. Something extra horrible is going on here. This is like something out of a horror movie. And my point here is that historically, this hospital has been viewed as almost a patronage system, doling out jobs for people in the communities. You've got Maxine Waters and others defending this hospital, Jesse Jackson, Al Sharpton, and others, even though they should have been on the side of the community demanding that the hospital live up to its responsibilities.
What you're saying is it's a political patronage situation. Congressman Waters and others don't care about the performance. They just want to put people in there. We should say the hospital administrator has been fired over this, but obviously a very, very troubling situation.
No reform here. They need to close it down and start all over again.
All right, Mr. Hicks, I agree with you. I don't think we can have this in the United States of America, even though it is an awful situation in that neighborhood.